nominees, congratulations on your nominations. I think I'll just start here. I think the U.S. response to COVID-19 will go down in history as the worst failure of domestic governance in the history of the United States. And I feel very emotional as I say those words. There have been some failures in the U.S. on foreign policy issues that have been notable ones, but in the sense of domestic governance, I cannot think of a worse one. This is now the third most deadly event in the history of the United States, just a single event. Spanish flu, 675,000 Americans died. Civil War, 620,000 Americans died over the course of the war. We're now north of 500,000 and climbing, more deaths than the entire World War II, for example. So many of these deaths were unnecessary if you measure the United States against the experience of other nations, and set aside nations that are communist nations that have a command and control over citizens that a democracy doesn't, but just use democratic nations, our peers in the OECD or in the G7, and look at their experiences. And if you just wanted to average them together and say, if we had done what they had done, hundreds of thousands of fewer deaths. In the last couple of days, Dr. Fauci said that no nation handled this worse than us. And we're a nation with the best healthcare institutions in the world, the best healthcare providers in the world, an industrial base that, when pressed under warp speed, did an amazing and miraculous job of producing a vaccines, multiple vaccines that work. We've had healthcare providers on the front lines who have just been unbelievably heroic. We've got Virginia guardsmen and women from other states who were out doing the testing and then out again doing food bank distribution, and they're out right now doing vaccination. So many people to be proud of, but how did a nation like this, how did a nation like the United States find ourselves in a position where we have led the world in deaths at such an untold scale? It really just started, in my way of thinking, there were a whole lot of things that caused it, but it started with a big lie, perpetrating that this was going to go away, that it wasn't anything we needed to worry about. We've learned that a president with a microphone has the loudest voice in the world, and that voice can be used for good or evil, but the big lie that was perpetrated at the beginning of this, together with other errors like the CDC mistakenly deciding not to use the WHO test protocol and then developing a faulty protocol on their own that had to be scrapped. This put us in this horrible situation. I'm very emotional about this. I know 9 people who've died of COVID. Last time I checked, the nation of Taiwan only had 9 deaths. The entire nation, right across a narrow strait of water from China where the virus originated. I think if we're not willing to sort of acknowledge that, look in the mirror, then we're not going to be prepared for the next one. And one of the things that I'm excited about both of you, your nominations, is you have a track record that can help us prepare for the next one. I have colleagues who are very focused on trying to do a 9/11 commission to analyze the events that happened here on January 6th. We need a commission that will analyze why the U.S. got the pandemic wrong. That's much more important. Senator Collins, you and Senator Menendez had a bipartisan bill to do that, which that should be a pressing need for us to analyze what went wrong in the pandemic, because there will be another one. And when there is another one, we have to show that we're wiser and able to deal with it. Dr. Lean, I want to ask you a particular question. I was a little worried at the beginning of the Biden rollout of sort of a COVID response team that I didn't see enough people who I thought had state-level experience. As a former mayor and governor, I love doctors, I love academics, I love people at think tanks, I love the brainiacs, but I really love the implementers. Because what happens in a situation like this is everything we do has to survive the reality test of being able to be implemented at a state level or in a city. Talk about your state level experience and what that does in terms of adding to the team so that we can both fight our way out of COVID, but then ensure that the nation never falls down so badly on a job as we have in the last year.
Well, Senator, thank you very much for that question. Thank you for your passion about this subject and for public health. COVID-19 certainly has been the biggest public health crisis that the country has seen in 102 years, and it has taken an enormous toll on our country, and with over 500,000 deaths. Each death is a tragedy, as you've been pointing out. I think that this pandemic has shown the importance of public health like nothing else possibly could, and that would include local public health, state public health, and federal public health, and most importantly, the collaboration and coordination between all different aspects of public health. You are correct. As the Secretary of Health in Pennsylvania, under the governor's leadership, I led Pennsylvania's response in containment and mitigation, and then distribution of medical countermeasures such as medications, remdesivir, monoclonal antibodies, and the vaccine. If confirmed to this position, I would very much like to take that experience in operationalizing the federal initiatives and the federal guidelines and strategy really at the state and local level, and I hope to make my contribution that way.
I'm over my time. Thank you for indulging